my name is Jenny. I will be demonstrating how to change a chest tube dressing. And I'm looking at my patient's MAR, Jennifer Doe, date of birth 11/5/1975. I'm checking for allergies. I'm making sure she's not allergic to iodine or any other sensitivities to cleansing agents or tape. And she has no drug allergies listed. And she's due for a chest tube dressing change. So I already gathered my supplies. I'm gonna go ahead and enter my patient's room. Provide for privacy. Wash my hands. Hello, my name is Jenny and I will be your student nurse today. Can I have you please verify your full name and date of birth? And she says Jennifer Doe, date of birth 11/5/1975. Thank you, Jennifer. Can I have you tell me if you have any allergies at all? And she says no, she does not have any allergies. How about any sensitivities to cleansing agents? She says no, no sensitivities. Okay, very good. And Jennifer, I'm here because I need to change your chest tube dressing. It looks like it's a bit soiled. And I would have assessed my patient beforehand. I would assess her pain level, vital signs, respiratory status, make sure she's not having any difficulty breathing at all. How are you feeling, Jennifer? She says she's feeling comfortable and that she's ready for the dressing change. So what I'm gonna do is I'm just gonna wash my hands. I'll open up my supplies here, get things ready. I already prepared a Chuck's pad underneath for any drainage. And then I'm only exposing the area I need to. Okay. So I'm just gonna go ahead. I'm gonna pour my normal saline. I checked the MAR and I made sure she's not allergic to normal saline. And I checked the expiration date and it's good until 12/2022. I'm just going to go ahead and pour that now. And then I'm going to put my applicators in there. And I already prepared my biohazard bag right here on the table. And then I'm going to go ahead and just kind of open up my Vaseline gauze. And my drain sponges with a slit in them, and then 4x4 gauze. I also have my foam tape available, some clean gloves, prep pad if needed, and my sterile gloves. So what I want to do first is I'm going to go ahead and grab some clean gloves here. Grab one more here. I also have my wastebasket close by. So what I want to do first is I'm just going to actually palpate and assess for crepitus. So I'll work kind of at the insertion site and work my way outward. I want to work your way up as well. Okay. And if for some reason you did notice crepitus, you would maybe want to outline it for documentation and so you can further assess for progression if it were to progress and get worse. And if that were the case, you would want to notify the provider. So at this point, I am ready to remove the old dressing. And to do this, I want to kind of stabilize the tubing and kind of work my way from the outer edge. I'll gently pulling back. Making sure not to dislodge that tube. I'm just going to set my old dressings right there. And while doing this, I'm assessing for coca on my old dressing material, so the color, the odor, consistency, and amounts. Then once I remove Vaseline gauze, I'm going to assess the site of insertion. I'm assessing for any redness, edema, ecchymosis, the drainage if there's any present, and the approximation. Also, if there's any sutures present, I'm going to make note of that as well. So I'm ready to dispose of these clean gloves. I'm just gonna wash my hands. How are you doing, Jennifer? She says she's doing fine so far. Okay. Grab this glove. Extra one here. And for this procedure, it's also important to have your patient in a semi-Fowler's position if they're able to tolerate that, because it assists in the drainage. Okay, so now I am ready to cleanse any dried secretions or drainage. So I'm gonna grab 2 cotton tipped applicators and kind of work from the center of the insertion site outward. And I will toss those. Then I will do that again. Kind of gradually work my way around. Toss those. And now that that's clean, I'm also gonna just dispose of my dressing in my biohazard bag. I'm gonna remove my gloves. I'm gonna wash my hands. And I am ready to apply my sterile gloves. Once my sterile gloves are applied, I'm ready to reach for my Vaseline dressing. And I'm going to unravel this and make it into kind of a ribbon-like. It's kind of twisting motion like that. Make this as sterile as possible. Trying not to This is to keep the site, this is the occlusive dressing. Once that's applied, I'm ready to move on to my drainage sponges. Once those are applied, I can put my 4x4 gauze or ABD on top. Okay, and since my hands are a bit oily, I'm going to remove my sterile gloves at this time. Throw those away, wash my hands. I'm going to put clean gloves on for applying the tape, just so I can grab at it a little easier. Once you get this started unraveling, I'm going to try not to touch the center. And if your patient has any sensitivities to the tape, you can apply skin prep to help with that, prevent any irritation. Sure that you have a nice airtight seal. want to label the date, the time, my initials that this dressing change was done at. And I'm going to go ahead and remove my gloves. I will clean up my table, throw away my trash, wash my hands. I will see how my patient is doing. She says she's doing fine, that she feels okay. And I would also want to make sure to document the date and the time of the dressing change, how the patient tolerated it, any assessment findings, COCA, RITA, if there was any crepitus, making sure to note of where that was located. And I would ensure patient safety before leaving the room. Bed is low, call light within reach. I would cover my patient back up. I would also assess my chest tubing, making sure there's no dependent loops, making sure it's not clamped or caught in anything. And then just kind of assess my system and making sure that everything is working properly, that it's sitting upright. And some lifespan variations is if for some reason you had a child, you might want the mom present for the dressing change because the child's probably in quite a bit of pain. And I think that covers everything. That concludes the video. Thank you.